Thank you, Dr. Sugar Engineer, for giving me this not so sweet task of compiling so many articles together. But in the process, I learned a lot too. So it's about orbit, or I've tried to summarize or pack in as many articles as possible. So my only disclosures are we believe that we are the protectors of the eye, the head, neck, and so on. So beware of any foray into the other territories. Thyroid eye disease forms a major chunk of our OPD, and the advances have been revolutionary over a period of time. In that, this particular article, what they studied was the use of 5-fluorouracil in the treatment of myopathy. So generally patients, even if they cross the active disease state, they still complain of diplopia and they have squint issues. So they have used the property where metabolically active cells such as fibroblasts are being arrested. And here they've used an needle to inject it into the orbit adjacent to the affected extraocular muscle to deliver the drug. According to their study, they claimed that the esotropia improved and the patient complained of lesser diplopia in the postoperative period. The second thing was a review article about the use of triamcinolone injection in treatment of lid retraction. So triamcinolone works by suppressing the immune response over a period of time. Being a review article, what they noted was the use of triamcinolone as subconjunctival or periocular was more efficacious in patients who had an active thyroid eye disease compared to inactive. And the effect lasts for nearly 24 weeks, which is good enough for the patients. And sooner the treatment, the better the outcome. When they compared it with injection botulinum toxin, they found it to be more efficacious because there was local perfusion into the soft tissues. So amniotic membrane transplantation has been described widely in cornea and ocular surface diseases. So how is it relevant in oculoplasty? So its nature as a transparent material with good color match and texture, and obviously a plus for us is sparing the donor site, and also its anti-adhesive properties served as a substrate graft and scaffold and reduced healing time in many procedures in orbit, eyelid and lacrimal surgeries. One interesting use that I felt was it was used to wrap muscles in an orbital fracture repair where there was adherence syndrome. The other would be in socket reconstruction and cicatricial entropion, and as well as adjuvants for flap and reconstructive surgeries. So this probably would be a game changer. I'm yet to use it in my practice. That is the use of tranexamic acid in eyelid procedures such as ptosis and blepharoplasty. So according to this randomized control study, they used the properties of tranexamic acid as an antifibrinolytic, and they mixed it with their routine lignocaine composition. And what they studied was that it reduced the ecchymosis and lid edema in the post-operative period. So this is probably a game changer. I believe most of the dermatologists are already using it in their practice. So this is called plasma exeresis, where the property plasma ablation, that is the solid state of tissues are converted into gaseous state directly with the help of ionized energy. And this is without direct contact with tissues. And it ensures accurate and precise ablation of the skin layers and avoids damage to the underlying structures. So where this has been very useful is in peripunctal lesions, because you want the puncta to be intact, and if there is excess heat delivered, it can result in a punctal stenosis. The only disclaimer would be to exclude lesions with a suspicion of malignancy. This was an interesting image that I came across where we all know that vitiligo is an autoimmune disease. So when you have segmental disease confined to the eyelid, this was a drug that was found to be useful. It is ruxolitinib, which is a selective inhibitor of Janus kinase. It comes in a topical formulation of 1.5%. The only drawback of this is a tube costs about 10,000 rupees. So no talk would be complete without mentioning recent advances in retinoblastoma. These are two excellent review articles, one which has come from our very own Indian subcontinent, and Dr. Advaita happened to be my co-fellow too. So I would not go into the details, but a particular thing would be the targeted therapy that has come of late, where they have started to use immunotherapy, immune checkpoint inhibitors, and matrix metalloproteinases in treatment of retinoblastoma. Also, chemoplaque using topotecan, which is used as an episcleral plaque, that is also said to slowly release the drug into the vitreous tissues. IgG4, this is an entity that as ophthalmologists we all should be aware, and the very reason that you would see a hike in articles on the same. So this was a beautiful article which mentioned this topic under all the subtopics. So one, you can have periocular painless swelling. It can affect virtually all structures. Orbital imaging is key, and also incisional biopsy with a histopathological examination will clinch the diagnosis. You need to refer such cases to a rheumatologist to rule out any systemic involvement, and obviously it's a comprehensive treatment. So not just looking at ophthalmological articles, you need to look a little away from it too, often to improve your treatment, such as in cases of myasthenia gravis. So we are all aware of how pyridostigmine is being used, as well as plasma exchange is being used. So it was interesting to note that these are obviously in trial state. So they have used complement inhibitors such as eculizumab, ravulizumab, and also neonatal FC receptors, which actually help in the recycling of antibodies. Those are the AChR antibodies that are there in myasthenia gravis. So I leave you to read the name of the drug yourself, because it's quite tongue twisting. So I end on a very light note. This was by one of my teachers, Dr. Shahid Alam. So he came across a very interesting phenomenon called lacrimal flatus, which was observed in patients who had undergone probing. And he noted that on pressing around the region of the lacrimal sac, you would see bubbles or you would hear a sound. So the explanation for this was probably due to probing. The valve of Hasner resulted in reflux of air that was trapped within. So if you have patients coming to you saying that, yes, I hear a weird noise, then you can reassure them saying the same. So these were the journals that helped me sum up most of my articles here. And I'm also happy to inform that in 2026, we will be hosting the annual conference of Oculoplastic Associations of India. Thank you.
Brilliant talk, I must say. If I could ask you one question. The tranexamic acid, the injection, I think it would be a game changer, because post your lid surgeries, the main thing that is disappointing for the patient when they see the next day is the
Yes.
So is it available? You said you haven't yet had the experience to use it.
Yeah, I'm currently studying to see if it is actually safe in practice, but yes, it is available. It is freely available. It is in fact being used by anesthetists. They give it in the perioperative period.
Any other question?
So very interesting to note about the 5-flow uracil injection. So it's not into the muscle; it's into the orbit.
Adjacent, yes, orbit. So according to this article, in one particular patient, because the patient had the history of anticoagulants, they did have retrobulbar hemorrhage. But they are not exactly clear as to what period they gave these injections and how many injections it took for them to come to this outcome.
When active or in the fibrotic stage.
So what they mentioned was the active disease, where initially they had given steroids, but then the restrictive component had already set in.
So a bit of fibrosis is already
there. Setting. Yeah.
Any other questions?
Yeah.
Thank you, Dr. Anju.